The trigger shot is a shot that either creates or replicates an ovulation signal. And it's used in a variety of different treatment cycles. One of the more common ways to use a trigger shot is in what we would call an ovulation induction cycle. And that's where women are given typically oral medications, sometimes injectable medications, to develop and grow the follicles. And when the follicles look ready, sort of 18 to 20 millimeters in diameter, so think about the size of a red grape, then that's by ultrasound. Then the trigger shot is given to tell the egg that's inside the follicle to be released into the fluid inside that follicle, and then ultimately the follicle will pop. And trigger shots come in different flavors. We've got one trigger shot called Lupron, and that's a medication that tells the brain to send a signal to talk to the ovaries. And there's another injection called HCG that comes in a form called Avidril, or in intramuscular forms of HCG like Pregnil or Novaril. And those are given to again look like an ovulation signal. The egg grows like a marble in a hand, and if there's no trigger shot, then the fist is holding onto the marble, and if you're doing an egg retrieval, you're going to get the fluid, but the egg's not in that fluid. So the purpose of the trigger shot is to cause these cells to release the egg into the fluid. And then the timing of the egg retrieval is before this follicle, now with the egg floating in the fluid, would actually rupture and ovulate. The typical time for ovulation after a trigger shot is about 40 hours. So we typically will do the trigger shot 36 hours before an egg retrieval. So that egg is sort of ready and that follicle is kind of ripe, but again, it's pre-popping. In rare occasions, women will ovulate early for some reason. And so in those cases, in subsequent cycles, we actually will move that aspiration up, or the egg retrieval up, to 36 hours after a trigger. Lupron is commonly used in IVF where we're worried about big ovaries, high hormone levels, because Lupron is a safer trigger shot if we want to avoid ovarian hyperstimulation syndrome. Avidril is probably a stronger trigger shot, but it stays in the body longer. So if the ovaries are big and they stay big longer, that can cause a lot of discomfort for the patient after the retrieval. So a lot depends on how many eggs we think we're going to get, how high the hormone levels are, to pick either one or the other. And in some cases, we actually do lower doses of both, which we would call a dual trigger. Now, in an IVF aspiration situation, if we get fluid from follicles and the embryologists are not getting eggs, we'll oftentimes stop the procedure, recheck the hormone levels, re-trigger them, because if those eggs are trapped in that fist, it's a wasted cycle. So we rely on, again, clinical evidence at the time of the egg retrieval, hormonal evidence after the trigger to see if the body understood it.